Scrub typhus, which is also known as bush typhus, is a disease caused by bacteria called Orientia tsutsugamushi. This disease can be contracted when an infected chigger, which are larvae that grow into mites, bites you. These chiggers typically pick up the bacteria when feeding on the skin cells of infected rats or mice. It's important to note that chiggers are extremely small and can be difficult to see with the naked eye. They are usually red, yellow, or orange in color. Scrub typhus is commonly found in rural areas of Southeast Asia, Indonesia, China, Japan, India, and northern Australia. It was also reported in North Carolina in July 2023. Scrub typhus affects people of all ages and genders equally, with around 1 million cases occurring globally each year. You're at higher risk of getting scrub typhus if you come in contact with or are exposed to areas where the chiggers tend to stay. This can include rural or forested areas with overgrown lawns, weeds, shrubs, bushes, leaf litter, berry patches, edges of woodlands, and other damp, shaded areas. The bugs are often more active during late spring and summer seasons. When a chigger infected with scrub typhus bites you, it's usually painless and you might not even notice. But within a few hours, you'll start to itch a lot and see a small, reddish bump or sore around the bite. The bacteria takes about 6 to 10 days to start showing symptoms in your body. Symptoms of scrub typhus may start suddenly around 10 to 12 days after the bite. These symptoms can include fever, chills, a dark scab over the bite known as eschar that usually forms after the fever, rashes, headaches, body aches and muscle pain, confusion, swollen lymph nodes, bloodshot eyes, vomiting, diarrhea, lung infection. In severe cases, if you don't get timely medical help, you could go into a coma or have organ failure. You could also experience bleeding and other complications. If you notice any symptoms of scrub typhus, especially after traveling to areas with high levels of infected chiggers, it's important to call your doctor right away. Your doctor will examine the bite mark and look for other visible signs of scrub typhus. They may also take a sample of the rash and run tests to confirm the presence of antibodies from the bacteria. Scrub typhus is often overlooked as a cause of tropical fever, so it's important for your doctor to rule out other conditions like malaria, typhoid fever, dengue, and leptospirosis for an accurate diagnosis. In some cases, if a proper diagnosis isn't made, your doctor may need to redo the blood tests 1 to 3 weeks later to check for spikes in antibody levels. In the meantime, your doctor may start your treatment early while you wait for the results. When it comes to treating scrub typhus, antibiotics are the best way to go. The sooner you start treatment, the quicker you'll start feeling better. Your doctor will likely prescribe doxycycline, which you can take by mouth twice a day for at least 7 days. In more severe cases, you may receive the medication through N4. For children with mild cases, the CDC recommends a shorter 5-day course of treatment to minimize potential side effects like teeth staining or weakened tooth enamel. If you're pregnant or allergic to doxycycline, don't worry, there are other options available. Azithromycin and chloramphenicol can also be effective in treating scrub typhus. If the disease and symptoms are left untreated, it can trigger severe organ complications such as heart problems, which can disrupt your heart rhythm and cause issues like atrial flutter, fibrillation, sinus tachycardia, and bradycardia. You can also develop myocarditis, which is when your heart wall becomes inflamed and can cause fever, breathing difficulty, heart palpitations, or sudden cardiac death. Gut issues may include vomiting, nausea, diarrhea, liver issues, bleeding in your gut, and pancreatitis, with symptoms appearing 3 to 7 days after your fever starts. Breathing problems. In severe cases of scrub typhus, you could develop acute respiratory distress syndrome, ARDS, a life-threatening condition in which you have lung injury and fluid leaks in your lungs, making it very hard for you to breathe and get the proper amount of oxygen into your body. Kidney injury, as scrub typhus can cause an underdiagnosed complication called acute kidney injury, AKI, which can cause your kidneys to fail and lead to septic shock. Neurological issues. The bacterial infection can cause problems with your central nervous system, such as scrub typhus meningitis, and a more severe condition called meningoencephalitis, which can cause seizures and changes in your thinking and behavior. You may also develop visual hallucinations and nerve pain. But getting treated early can ease symptoms and help you get better faster. Unfortunately, there is currently no vaccine available to protect against scrub typhus. To lower your chances of getting scrub typhus, there are a few things you can do to prevent getting a chigger bite or coming into contact with them. If you're hiking or in an area with lots of chiggers, cover your arms and legs to reduce the amount of skin that's exposed. Use insect repellent like DEET on your skin and clothes. Avoid sitting directly on the grass. Put on sunscreen after applying the repellent. For babies and children, make sure to cover their arms and legs, and if they're in a stroller or carrier, use a protective net. When using insect repellent on children, don't spray it directly onto their skin, especially if they have cuts or wounds. Instead, spray it onto your hands and then spread it onto their skin. For children under 2 years old, check with their doctor before using insect repellent. If you think you've been exposed to chiggers, wash all of your clothes and gear in hot water for about 30 minutes, and take a hot shower using soap to scrub exposed areas well. You can also treat your clothing, boots, and outdoor gear with 0.5% permethrin to add an extra layer of protection. Just be sure to read the product information and instructions carefully and never use it on your skin. It's meant for clothing and gear only.